Good morning. Good morning. I hope you can hear me. This is Dr. Mitra Ayozifar. I'm an ophthalmologist in Grass Valley and Roseville. I'm the CEO of Capital Eye Medical Group, where we help patients develop their best vision and also live their life fully and enjoy their hobbies for years to come. So today, this is part of the Monday morning Facebook Lives that I do every day or every Monday morning. And I wanted to come on here because so many situations have come up. I'll only mention a few where, I think patients may be wondering who's on what side they're on or who is their physician advocating for. So I wanted to let you know that we are on the same side, meaning your physician and you, we are both on the same side. Um, why do I bring this up? So a few situations that I want to tell you about. Essentially, my I have some patients that come to me for medical reasons to receive Botox treatment. So these are supposed to be medically covered. And these patients sometimes, if it's blepharospasm, they're not able to open their eyes. I had one lady that I was treating I think every 2 months she was coming to me because that's how severe it was. And then another patient was, and I have several other ones that come to me at various uh, frequencies. So some are every 2 months, some are every 3 months. And, if it's hemifacial spasm where they've had Bell's palsy, then it's, one side of the face. They may not be as often. So what I found in the past few years, especially since I've gone into solo private practice, is that it is not being covered well, it's being covered less and less often. So let's say if the patient needs it every 2 months, the insurance company will not cover it, but every 3 months, even though the patient is suffering for that, 4 weeks that are left. This is not a decision that I make. This is not something that I set the rules for. It's basically your insurance and, the rules that are coming up, and that determines how I'm able to treat you and still be covered by the your insurance company. So that's one thing. The other thing is for lid surgery. So I do a lot of lid surgeries, not just for cosmetic reasons, but also for medical reasons or functional reasons. So let's say a patient comes in and they have dermatochalasis, where the eyelid, the fold of the eyelid is completely covering the lashes and going beyond. Sometimes it's even, falling over so much that it's covering the pupils too. Or their eyelid is so low where the opening between the upper and lower lid is pretty small. And so this causes patients to bump into things. Some people come in and they have a bruise or a scab on their forehead, and when I ask them, so is the droopy lids bothering you? And they say no. And I ask them, what is that? Oh, I just run into this cabinet every once in a while when I go to the garage. So it's because their upper field of vision is blocked. Clinically, it's obvious that it's affecting their vision, it's affecting their function, and yet in order to have your insurance cover it, I have to jump through several hoops. Your physician has to jump, or your surgeon has to jump through several hoops. So one is taking the photograph in different fields of gaze, which a lot of you may be familiar with if you've had this consult done. The other is, documenting exactly the distance between the light that's in the pupil that you can see right now, that little pinpoint light, and the upper lid, but also, whether or not the insurance company wants to know not just whether your eyes feel heavy, but whether or not this is actually affecting your vision. So I have to have you go through as what's called a superior field of vision, where we do this test taped and untaped. And sometimes my patients, as human nature, clinically it looks like obviously this is affecting their vision, but when they do that test, I'm sure that they're looking around because that's the only way that this test does not meet the Medicare or insurance criteria to be done for medical reasons. I have to explain that I know that this is medically necessary, but this is just a rule that's set by the insurance company, and everybody goes, all the insurances go according to Medicare criteria, where it has to be a certain amount of defect before it may be covered by the insurance. I'll even explain one more further. At one point, we jumped through all the hoops. I've been practicing now doing these lid surgeries and practicing ophthalmology for about 20, almost 22 years. One case, we did the testing, got the authorization from the insurance company to do it, did the surgery, and they denied payment because they said no, this wasn't medically necessary. And when we mentioned that we have the authorization, the insurance company said no, but that's not a guarantee of payment. So I just want you, as the patient, to know that we do everything possible to give you the best care possible. And as physicians, your surgeons, we need you to do your part. So basically, I want you to be aware of what your copay is. Know what kind of insurance you have, whether it's a Medicare takeover plan, Medicare Advantage takeover plan, what's your share of cost, what's all of that, because that doesn't have anything to do with your physician or your surgeon. That's all choices that you make, and you have to be careful when you make these choices, when the time comes. I guess it's in October, November, when you can choose your new insurance. Please be aware of what you're signing into. If it's too good to be true, it usually is. The Medicare, Advantage takeover plans, make sure you ask, hey, my current doctors, check with them and make sure that they take the Medicare Advantage plan that you're going to sign up for, because otherwise we can't we can't treat you unless, if we're not a provider with that plan, we can't treat you unless it's you're paying out of pocket, and that's not anything that we can change. That's something that you have control over. So who's responsible? Basically, letting you know your physicians are on your side. This is such a frustration that keeps coming up. And I just wanted to get on here and mention that the copay is something that you sign up for with your insurance company. So when you come to our offices, to your physician's office, yes, you do have to pay the copay. Know what you're getting. Speak up. Talk to your insurance company. Speak with patient advocates, and even the insurance commission. If there's something that doesn't seem right or was being covered and is not, speak to them. This is not something that we control. On my end, I just wanted to let you know the things that have been happening. As far as probably about 12 years ago, Medicare decided that they are not going to pay for ptosis, meaning droopy eyelid, and blepharoplasty if it's done at the same time. Now, ptosis is when there's a muscle that holds the eyelid up. When that muscle has stretched or is not holding the eyelid up enough, I have to go in through the same incision that I use for blepharoplasty and tighten up that muscle. Medicare decided, well, you're going through the same incision, so basically it's the same surgery. We're not going to pay for the second repair, the ptosis repair, which adds another 15 minutes to the time of the surgery. And so what happened was, and if I'm doing blepharoplasty on both eyelids, it's buy one get one half off, essentially, as far as the fee reimbursement for the surgeon goes. So if I do one lid, then the other one is half off. If I do blepharoplasty, then insurance will not cover for ptosis. So what's happened is a lot of surgeons, and a lot of surgeons have stopped accepting insurance because of that. They've gotten off of the insurance panels because it is not conducive to private practice. Um, it's certainly not conducive to providing care and being able to provide you with time with your physician, um, and running a practice. So what you essentially are signing up for is either go to a place that's like Kaiser, where the doctors, the hospital, the surgeons are all employed under the same umbrella. Or if you want individualized care, then it is private practice. It is people like us who are trying to bring the best to you, trying to spend the most time with you, and make sure that we provide the best care. So I want you to speak up. I want you to know exactly what you're getting. I want you to contact your insurance company. I don't want you to get upset when there's a copay or there's a Medicare takeover plan or anything like that, because that's not something that I have control over. But believe me, I'm doing everything on my part to try and give you the best care possible. All of your physicians, we all went through medical school in order to help and care for our patients. It's, but that doesn't mean not being reimbursed for the care that we do provide. That doesn't mean setting the patient up or changing the doctor-patient relationship or manipulating it by the insurance companies so that it's, pitting it's almost like the patients are pitted against the doctors. But believe me, we are on your side. So please speak up, please advocate for yourself. Myself and my physician colleagues are doing our part to do the best for you. So please do your part and help us advocate for you, help us maintain the private practices and provide the practice that's personalized, provide the practice that is the best for you, not just what's good for the companies that are out there, insurance companies. So speak up, help us. And if you have any questions, post it in the comments. Some of you may not have watched this live, and that's okay. But if you watch it on replay, go ahead and put hashtag replay, ask any questions that you might have, or any situations that may have come up. Let me know. Let me know so we can start advocating and helping each other out. Okay, if you're looking to see where I'm at, you can find me on www.mitramd.com or Capital I Medical Group. My website is capimed.com, and I look forward to taking care of you and answering your questions. Take care.